Hello. So today's session is going to be on childhood and adolescent depression. And with me, I have Ms. Tejasvi Shetty, who is a psychologist at SRCC Hospital. And I am Dr. Parvin Dadachanji. I am the pediatric psychiatrist attached to the same hospital. Thank you for coming, Tejasvi.
Thank you.
So we seem to be hearing a lot about childhood depression. Is there something like childhood depression, Tejasvi?
I think you've asked a very important question. A lot of people are unaware or confused about whether children also experience depression, but they definitely do. And children as young as say even 3 years old can be going through depression.
Wow.
So, yeah. So I think a lot of times people, you hear a lot of people who come in and say that, is it a new age thing? हमारे ज़माने में नहीं होता था. But this is something that's always existed. I think with people becoming more sensitized about depression and also seeking help, we're seeing larger numbers of kids coming in with depression.
What does depression look like in children and adolescents? Is it different from adult depression?
While in both children, adolescents and in adults, we would look at the impact it has on the individual in terms of impairment in functioning, as well as how prolonged or persistent it has been. How it manifests would be different in adults and different in children. So in children you would see a lot of sadness, you would see a lot of irritability, you might also see a lot of anger, a lot of children who are discouraged. You might also see behavioral manifestations of it, like there'd be a lot of fights in school, missing school, you would see suicidal behavior sometimes, there'd be self-harm. There could also be physical manifestations of it in terms of changes in sleep. They'd be sleeping a lot or sleeping too little. They'd be eating a lot or eating too little. They could also show physical symptoms like headaches or stomach aches while all the medical tests are coming clear. So this would be an emotional manifestation, would be a physical manifestation of an emotional condition that's there.
Also, adolescence, depression in adolescence, which is on the rise, we see a lot of kids with adolescents with depression. How does that differ from adult depression?
Okay, I think adolescence is a really unique stage where they fall between childhood and adulthood. So there will be things which are seen differently in adolescence. So you might see a rise in risk-taking behavior in terms of kids who are abusing drugs, or see increase in alcohol consumption, or risky sexual behavior also. There could be similar appetite and sleep changes, but also you see a lot of self-harm and maybe even suicidal attempts. You would, one easy way of also identifying is changes in school. So they'd be missing out on a lot of school, or there'll be a drop in academic performance. There could also be changes in socialization. So at this age, friends are the most important part of their lives, but they might withdraw, or they don't interact as much, or they isolate themselves. So these are things that you can look out for when you have an adolescent who you suspect may have depression.
So why does depression occur in children? What are the causes of depression?
Depression is a very complex disorder which can have its basis both in biological basis as well as an environmental basis. So sometimes it could be that there's a history of mental health issues which run in the family and the child is experiencing a mental illness. While there are other environmental factors, things in your environment which can cause depression also. So it could be things like abuse, that the child has experienced abuse, or it could be that there's a lot of conflict happening at home, or it could be a child has been bullied or is doing really badly in school. So there could be different triggers to cause depression. It would depend on each child also, but there'll be a mix of both these factors.
So if a parent suspects that their child has depression, what can the parent do?
Okay, I think one thing is to be alert for the signs of depression. If you feel like what we spoke about earlier, if you notice any of these signs and symptoms are being experienced by your child, I would suggest going to a mental health professional just for an assessment. Another thing that you could do is, I think, having conversations and being open with your child. very often, especially in younger kids, they may not have the vocabulary to express exactly what they're feeling, but it doesn't negate the fact that they're going through something. So I think talking with your child about what has been happening, creating a very supportive space for your child. And I think it's very important to remember that sometimes, especially with children or adolescents, it might be a lot of acting out behavior. It may come out and it might be very frustrating to handle in those situations, but it's really important to remember that it's not about you. They're not intentionally being disrespectful. It's about the situation or the emotional
What they are going
experience
through.
that they're going through.
Okay.
Yeah.
So how does a mental health professional help children with depression?
Okay, so you can see a counselor or a psychologist who would, that's where talk therapy begins, and to be helping in managing and coping with depression, and also coming up with strategies for parents on how to handle their child. In many cases, especially if depression is severe, that's when a psychiatrist is also involved. Because depression is a biochemical condition and there is a need to manage the symptoms there. So that's when medication is given by the psychiatrist to handle the condition.
So you need a combination of a therapist as well as a psychiatrist for kids and adolescents with depression.
Yeah, absolutely.
Okay, so what I got from this was that depression does occur in children and adolescents. It's very much an entity, and it is treatable.
Yeah.
It only manifests in different ways. So if you're aware of all the symptoms which are there in depression, you would be able to identify it. And after identifying it, going to a mental health professional to get the treatment is very vital.
Absolutely.
So thank you very much, Tejasvi.
Thank you.